We, from a very young age, I know myself, have thought about what it looked like to snuggle those sweet little babies. A lot of us, my daughter included, imagined what it would look like to become a mom. I think a lot of us thought about the cute little baby snuggles and the coos and the laughing and all of these fun, wonderful things that still do happen. And yet, there's this whole part of pregnancy and delivery that, of course, we're not going to think of or know of until we experience it or have a close person in our life that does. And it looks so very different to each and every one of us. Hey, it's Denise from the Working Moms Redefined podcast, and we are so glad that you are listening today. It is a pleasure to get to live life with so many amazing women. And today's person who is on our podcast is a definition of someone who cares about others before herself and gives it her all, both at home and at work, and has done so for a large majority of her life. And it's also in those moments when you're like, God is going to give her sweet babies and it is going to go flawlessly because she deserves it. Don't we all? And yet, then he has a different plan for a lot of us, Jen Duesterhaus included. Jen is joining us today as a mom of three, recently three. And if you're watching on YouTube, your ovaries are screaming because this adorable little baby boy with cute little squishy cheeks and the hair that's like rubbed off part of it is on our YouTube channel. So go visit that right now. But Jen is also a business owner. She's a nurse practitioner student, and most importantly, she's a wife and does so many things for our community. And yet is here to share her vastly different birth experiences, whether they were traumatic and joyous, whether they were hard and peaceful. We're going to talk all about it from somebody who went through three different birthing experiences that some people don't even do in their entire lifetime. So, Jen, thank you so much for joining us today.
Thank you so much for having me. I am honored to be on the podcast.
We're excited. And as we get all of our listeners up close and connected, what is it that you hope that people take away after our conversation today?
There's a couple things. The first and most important to me is that this is a big part of my testimony that God is faithful and He brought us through some pretty intense stuff recently. Second, I just want people to know that, like, I've been in these hard spaces and you need to let yourself feel everything you're feeling after birth doesn't go your way. And lastly, I caution people when I do tell my birth stories that this is not everyone's experience. Don't be afraid because I know that listening to them, it might be a little scary if you've never experienced it before. So I don't ever want to scare people. I just want people to know what kind of what we went through and kind of how we move forward past that.
And give joy to the one who gave us these gifts while also giving a large amount of recognition to the fact that it was really hard. And yet you came out on the other side with your husband and your kids, and of course, God's faithfulness. I cannot wait. So, before we get into the last birth, can you kind of dive in to walk us through how each one shaped you in different ways?
Sure. And yeah, they were all very different. So the first one with Noah, he just turned 5. We were induced right before my due date. We didn't make it very far at all. I only got to like 2 to 3 centimeters. I really never had a chance to make any progress because his heart rate was going down from the very beginning. So once he came out, we found that his placenta was really calcified, so it wasn't working well. And his cord was in 2 true knots between his head and his shoulder. So he was essentially getting no blood flow. And we realized that the C-section absolutely was the right call for him. There was no way he would have been delivered safely had I tried to push him out or anything like that. So but the experience was so unexpected. Obviously, young, healthy pregnancy, no complications, did not expect to have a C-section. It really opened my eyes to what that looked like. I had seen one in nursing school, but obviously never experienced it before. So it was quite different from what I expected. And then just the recovery and mentally and physically being a lot harder than I expected after birth. But it was okay. because we knew it was the right choice. So, the second was Joel, and we did have a miscarriage in between the 2. So, Joel's pregnancy was a lot of fear. Um, Pregnancy after loss is hard, and, so there's just a fear kind of surrounding all of that anyway. And then I was afraid of the same thing happening and would his placenta hold out? Would everything be okay? So I agreed to an induction again with him and I made it like 24 hours and that we got to like 4 to 5 centimeters. And then it was like midnight, and the nurses kept running in and flipping me from side to side because his heart rate would go down. And I just got so anxious because of the trauma from the last birth that I just really panicked and was like, okay, we're doing the C section. I can't do this anymore. So I think I just didn't have the right support. And if there's one that I wish I could have back, it was that one because I feel like, of course, in hindsight, you have lots of thoughts. Should I have done this? What if I had done that? And that can plague you for a while. But that's the one where I thought, gosh, we probably could have made it had I had the right support in place and the right team around me to kind of get me to that point. But you can't let yourself stay in that for too long because you'll just be overthinking everything and it doesn't help at all in the process. So,
So after
yeah.
baby number 2, then you guys were blessed to get pregnant a 4th time, and you had expectations, I'm assuming. What were your hopes for the safe delivery of this sweet baby?
So I did a lot of research. I really just kind of dove in between Joel and baby number 3, and, I thought, "I am prepared. I'm in a different place mentally, physically. I was in much better shape." So I was like, "I am ready." I got a doula. I had I switched to OBs, hospitals. I changed everything. So I'm like, "This I feel like I'm just gonna trust God, and this is gonna be this perfect redemptive birth, and I'm gonna share my story, and it's gonna be great." So I had very high expectations, like, C-section did not enter our vocabulary, we didn't talk about it, it wasn't an option, it just wasn't on the table. Of course, I was like, if the time comes and something is going badly, I'm not gonna be reckless, I will do a C-section, but it's going to be because of a medical reason and not because we did interventions that kind of led us down this cascade, they call it. So, yeah, so I was feeling great about it.
You had a good amount of, like, loose plans. It was so neat for me personally get to see you over this time period because I feel as if you've blossomed, not only from just becoming a mom in general, but from that second delivery to now. Because you were very honest. I have loved that about you. You were very honest about that anxiety and fear that was in you, and rightfully so. I mean, there is until you have a miscarriage or a a baby that is stillborn, there is a fear that is undescribable. Yes, we turn to God, but I also think that that's where he makes us human is that fear that he places in us allows us to trust him more or go to him in more times of need. But to see you so beautifully and eloquently say what you wanted out of baby number 3, you lived that out day in and day out. I saw you a week or 2 before your delivery, and you were literally sitting on the stairs training a co-owner how to do the scheduling for the business that you all own employees. And you were calm and you were patient and you were not frazzled. And she really was. And there were people asking you, like, when are you going to be due? And I'm just like, I want to know about a VBAC, right? Because I was able to know so much more. And I knew through conversation how much a VBAC meant to you. You know what? Before we continue, as I'm saying that, can you explain what a VBAC is for those who might not know?
Yeah, so it's just a vaginal birth after C-section. At Blessing in here in Quincy, that's our, main local hospital, they had not done it for quite a while, and they started a program to do them again right after Noah was born, or right before, I think. So, at the time, my OB was like, "You'll be a great candidate for VBAC, there's no reason why you can't do it." So that was kind of in my head from the beginning. as soon as I had it. I think I was still in my hospital room, and she's like, "You could do a VBAC." I'm like, "Well, okay, I just had this one. Is okay." But we're not there yet. So then after 2 C-sections, the data says that the risk of, like, uterine rupture is not that much higher than after 1 C-section. Technically, the risk doubles, but it's, like, from 1% to 2%, so it is all about how you frame it. One OB said, "Well, the risk doubles," and the other OB that I saw said, "Well, it's about a 2% risk." So just, um at Blessing, like, they're just not really quite there yet. So I did go to Hannibal to deliver because they have been doing VBAC for a long time, and they're very supportive, the nurses, the doctors, and you have less of a chance of your doctor not being on call and then somebody else saying, "I don't support this." At Blessing, it's kind of just they're just not there yet. So
That's okay.
in the trauma of being there too after the first 2, um, not to get off topic, but it was just kind of the minute I walked into the hospital, I knew I was gonna have so much anxiety from the last 2, and I was like, "I need a different place. I need just everything to be different." So
Environment is so important, so important. So, going into your third pregnancy, you had so many hopes and expectations around having a VBAC. Why was it important for you, both emotionally, physically, and spiritually?
I think there's several things, but one is just feeling like that is what we were made to do, is to have babies, and if you can't get them out on your own, that does a lot in the headspace. So, one thing just I think being able to do it the way God designed at least in my head. And the other probably biggest thing was the moment that they put the baby up on your chest, like, that's what I had missed so much in that golden hour. That's the part that I was really hoping for. So, those were probably the most important things, just kind of that bonding with the baby and things like that. So, um, I think those were the biggest reasons why I really wanted to be able to do it.
Mm. And then he came along. He entered the world, but before he came, can you kind of give us a rundown of what happened with this little cutie?
Yeah, so I had gone in once, thinking I was in labor, and it was probably really early. I was like a centimeter. They kept me overnight. I made it to 3, and at 3 centimeters, I just stopped. And they're like, "Well, we could break your water, but then you're going to be kind of on the clock because they want you to deliver within 24 hours of your water being broken." And my OB was great. She did not want me to have anything to do with Pitocin. She was absolutely no Pitocin, and so we were all on board with that because that obviously would have increased the risk of uterine rupture with my situation. So she's like, "Then we're on the clock, and we can't give you Pitocin, and we don't know if you'll get there or not." And so my husband and I had a long conversation that morning about, do we stay? Do we go? So like, you could go home if you want, your water's not broken. Like, you're at 3. My contractions had slowed down quite a bit. So like, we really just leaned in and wanted to trust God's timing. So we went home that day, and then I had contractions off and on through the week. My due date was Thursday, and I saw my OB in the morning, and I was still at 3, and so she did a membrane sweep, and I got just, like, increasingly uncomfortable
Mm.
throughout the day. I see you making that face. I did not think it was that bad. Everyone
Oh,
else
Jen.
maybe because I had already been in the hospital and been checked so many times, I was just like, "Oh, it's" I didn't think it was bad at all. So the membrane sweep wasn't bad for me, but then I went in that night, contractions were pretty consistent. My doula said, "Probably go ahead and go in," and I thought, "I have to be making progress, like, I'm in so much pain." Still a 3.
Oh.
So, I made it through the night. In the morning, she came in and she's like, "What number are you hoping to hear?" I'm like, "Anything but 3." And so I think I was at a 4. I'm like, "Okay, it's not 3, it's
Yeah.
4. We're making progress." So that was Friday. I labored throughout the day, didn't make really any more progress, and I was getting tired, and I was just in a lot of pain. So at that point, I realized I was not made to birth a child without pain medication. And for those that do, oh my goodness, I was just like, there's no way I would have made it through that. So I got an epidural, decided to just rest for the evening. We really didn't want to do any big interventions leading into overnight. So I slept fine, everything was going good. About 6 Around 6 that morning, the nurse came running in and she's like, "I'm gonna check you." I'm like, "Okay." Like, "I'm having a contraction." She's like, "I'm gonna check you anyway." I'm like, "Oh, okay, this isn't good." So he had had a decel then, and everything flooded back. Like, this is the same thing we've been through. So I was really emotional, and my friend was coming in to be my nurse that day. I'm like, "When is she gonna be here? I need her to be here." They're like, "She'll be in soon." His heart rate came back up, he recovered, like, we were doing okay, and I had made a quick change from, like, 4 to 6 then, so they're like, "It's probably just because you made fast change. It's okay. That happens." Okay. So, we broke my water about 6:45 because we thought, "It's been long enough, we're ready to get things moving." I just break my water, and everyone was on board with that plan. Um, and then Stephanie got there at 7, that was my nurse, and she had a student, she was kind of walking the student through everything, what was going on, what we'd been doing, and I started to get nauseous and feel a lot of pressure, and I'm like, "Okay, this is good." I've heard, like, because 'cause I've never been through this before, I'm like, "Maybe I'm almost ready to push." She checked me and I was still at a 7. I'm like,
Ugh.
"Okay." Like, I really thought I would be like, I'm like, "I'm ready." Um, and then he started to decel again, and the OB came in, and I think it was pretty low. I asked my husband the other day, we hadn't really talked about it. He said his heart rate got down to 30, and I was
Oh
like,
gosh.
I didn't know it was that low, like, I didn't and because they kept trying not to tell me things so that I would like, everyone was on board with knowing we needed to keep me calm and knew what I had gone through, and that was one thing they were so great about. They never had the sound on, the, like, heart rate, because I knew if that sound was on, I was just my mind was spinning the whole time, so they were great about that. Then the doctor, I could tell I think he was just gonna try if there was any way he could get me to dilate the rest of the way and pull him out, he would've, but he couldn't. And then about that time, I just felt awful. I was like, "Something is wrong. I feel terrible, like I'm gonna throw up, I kinda feel like I'm gonna pass out, I'm clammy." I'm like, "Something is really wrong here." And it was about that time he got me to stop and think, and he's like, "Where is the pain right now?" And I was like, "It's all over my abdomen. It's everywhere." And he came and he got down at eye level and he said, "I know this isn't what you want, but we have to go do a C-section." And of course, at that time, I kinda knew, like, where we were headed, but yeah, that's that went by really fast. That was all about an hour. He was delivered at 8:35,
Oh
so
my.
it went quick.
And I think I get more emotional about this just because I know how much you wanted that. And I'm so proud of you because, I mean, at this point, he's 8 weeks and you have done a really great job of feeling the feelings, like you said to us earlier. What happened when they took you back for a C section? What did they find?
Um, so my uterus had ruptured and it ruptured up both sides of my bladder. Um, I think that it just had to have been just shredded, like, when they opened me up. I remember he started to cut, and luckily anesthesia was there, and they were getting my epidural because they do their epidurals a lot lighter. So he started cutting, and I'm like, I can feel that." And the anesthesiologist was just like, "You're gonna be able to feel it for a minute." And I was like, "Okay." Like, I just wanted to make sure that you knew I could still feel him cutting.
Mhm.
Like, at that point, I was so out of it. I was just like, "It's fine. I'm just letting you know I can feel it." Like, it didn't even bother me that I could feel him cutting. And that's how you're like, "Wow, okay, yeah, a lot was wrong if you, like, were not bothered by the fact that he was cutting you open." So, that's one thing that sticks out to me. And this OB that did my surgery, he's been around forever. He said he's never seen anything like it. And there were 2 nursing students there that day, and he said, "You guys have to come over and look at this. You're never gonna see this again in your life." So, he goes, "I just pulled your baby out of your bladder, like, up through my bladder. It was just open." So, when he was telling me about it, he's like, "You just it was crazy the way I ruptured."
My hands are clammy just thinking of this. Now, I'm going to guess that you had your mom hat on for most of this. Were there any moments where your like medical student thoughts flooded your brain like, "Oh, this is actually really bad," or was it strictly like, "Just get him out"?
Yeah, it's definitely mostly mom and panic in that moment. Kind of all common sense or rational thought had left my brain at one point, and I was just panicking, just very much panicking because I knew he was in trouble. But I don't know, it's mostly mom. I don't know if it's like that for everybody in that situation, but I was very much mom and very much worried and just worried about him mostly.
Looking like a true mom. You've talked today about leaning on your faith in moments of joy and fear. When did you realize, or was there a specific moment that you needed to let go of your plan and really just trust God?
I don't think in the moment I really recognized it, but the one I of course, was just starting to freak out, and Stephanie looked at me and she said, "The best thing you can do for your baby right now is stay calm." And so I took a couple deep breaths, and from that point, I think I just kind of dissociated a little bit, honestly. I felt like I wasn't really feeling anything. I was just laying there, letting them do whatever they needed to do. And so that was when I got kind of out of it. Could also have been because I had lost so much blood at that point, probably related. But I think that was the point where I just kind of let everything go and was like, okay, this is happening. Like, we need to get the baby out.
So here he is. What's his name? What was his ounce? Like, tell me about it when he got presented to you, if you will.
Yeah, his name is Levi Matthew. It took us a while to come up with the name, because he was in the nursery for about 24 hours, so I couldn't see him for that time, which was really hard, knowing that the main reason I wanted the VBAC was for the golden hour, and then we were apart for 24 hours. That was a kicker for me. But he was 7 pounds, 10 ounces, 20 inches long, so it was a good size. He only needed the nursery for that 24 hours, like I said. They gave him a few breaths when he first came out, but other than that, he breathed on his own. They just put, like, the mask on to help him keep remembering to breathe enough times, so he did really well, all things considered.
So then, when you guys were reunited, I'm sure it was absolutely wonderful and beautiful. And yet there was probably tension there, sadness, joy, missed opportunity. How did you navigate that disappointment and faith and joy all at once?
It's been a lot. I was really emotional when they did bring him to me. They said they had fed him a little bit, and they're like, "We think he might still be hungry." I'm like, "Okay, let's just try." And he just latched like a champ and ate and hasn't had any problems with eating. So that was I think of the whole thing, that was the biggest God moment that, like, really just stunned me was how incredible I that was the most emotional moment for me was when he ate great, and I was like, "The whole 24 hours is just fine. It's just fine that we were apart." So, thankful for things like that, just finding little things when it's hard. I tried to journal, and just come up with things that I was thankful for every day when, it's hard to make it through the recovery and things like that, because that was a lot more difficult this time, um, than before. Yeah. So
Understatement.
yeah.
What did that look like recovery wise? I mean, not only did you have a third C-section, but you didn't have a bladder or a uterus. Like what? Did you have a catheter?
Yes. So I had a catheter for 2 weeks because of all the stitching and all they had to repair. They're like, "Your bladder can't expand at all. We have to keep it compressed." I'm like, "Okay." That actually I think the catheter was one of the hardest things for me to deal with because I felt so limited, like I couldn't get around and I didn't like the leg bag and I didn't go anywhere. So at first they told me I would have it for a few weeks and then they said a month and I'm like, "Oh my gosh." But then I had a follow-up appointment with urology at 2 weeks, and I was able to get it out. So that was amazing. I it was brutal. It definitely gives a new perspective to experience some of those things that I I think as nurses we really get numb to all that, and it's just normal to us, but to know, like, how it impacts the people that live with it day in and day out, it's a huge, impact in your lifestyle. So I can find ways to be thankful for everything. Now I can relate to my patients with a catheter better. There has to be a bright side, where you just kind of go down that rabbit hole of feeling sorry for yourself, but you have this baby and you're healthy-ish, and so you have to find the positives for sure.
It's a testament to the work that you have done because the person standing here today would not, I don't think, have viewed this scenario as the person who had baby Joel. Like, I love to have seen the growth and the vulnerability and the faith that you have. And I love to take moments like that because you might forget or not feel it because you live it every day. But from an outsider's perspective, it is amazing to have watched you. And yet, well, let me ask you, do you still even have a uterus?
I do, yeah, he was able to save it, yeah. I know, that's what everyone asks, and, Doctor Bennett in Hannibal, he's been doing it a long time, he saved everything. I couldn't convince him to just go ahead and take my tubes out then, because I lost, like, half my blood, and he's like, "We're just gonna leave that alone."
Did you feel since this time, specifically any grief about the delivery or the birth that you thought you wanted from a little girl to now it definitely didn't turn out that way? And I think I know this answer, but I love to give that space for you to be like, "Yes."
Yeah, for sure, and I think it is definitely right now, I think I've been so busy with all 3 boys that I have struggled to sit down and actually work through that, and I kind of kicked myself too because after Joel, we thought we were done, we were good with 2, it was fine, and so our gap is a little bit bigger between him and Levi, they're 3 years apart, and so I had finally gotten to a good place where I felt like I had worked through a lot of that and I didn't feel there's a lot of, you see people having vaginal births, these that you kind of make up in your mind, that's how mine should have gone or that, and you don't even know that they didn't have a traumatic experience. You just see the pictures afterward, right? So, um a lot of that is just reframing it, and my lovely therapist has helped me with that a lot. Yep. So I think, yeah, it's gonna take time, and I know it's gonna take time, and I'm gonna have more therapy sessions where we talk about it because that's kind of the place I have right now to work through that and, um, make sure I'm going through it and not just stuffing it aside, yes, and never actually processing it, because you don't wanna keep that negativity with you, it just hurts for longer.
So, so true. I am amazed. I'm also amazed at the fact that this little sweet little boy has done so well. Levi, you are a champ. So, if by chance somebody is sharing in a traumatic birth, I mean, I have to, and like literally listening to you, I'm like, oh my gosh, it's still too soon, and they're 7 and 9. What would
Mhm.
you advise people who have had something like that? What would you advise them to do?
Really talk to someone because it does help, like, just sharing. I'm happy to share because it helps me, I think, too, just kind of process through everything and the questions that I get asked that I might not have really thought about before kinda help me to think of other ways that I can, take positivity from it and things like that. So, whether it be in therapy, which is I recommend therapy for everyone. I think everyone should be in therapy, but a trusted friend or someone at church or anything just to share it and have someone walk through it with you because it is you have lost something. Like you even if it wasn't a C-section, if it was a traumatic vaginal delivery, you lost the delivery that you thought you should have. And so to yeah, and I wanted to also mention while we were here that I can talk about this right now and then cry about it an hour from now. It is true grief where you don't know when it's gonna hit you. And that's okay. And like we need to give that space and acknowledge it and work through it. Like I was telling Sarah, that my therapist, that I've been to the Children's Museum a couple times recently, and I heard moms talking about their birth stories, and they might not have even been good ones, but it just immediately, I almost started crying just because it's that like trauma response that triggers like so. And she's like, just cry then. I'm like, I don't want to be crying in the middle of the Children's Museum because someone was telling their birth story. But she's like, you have to let it out. So, um, I think at church a couple weeks ago, I've just the fountain, the waterworks came down, and my husband's like, what happened there? I'm like, just processing. That's all. Just processing. I said I knew it was gonna happen sometime, didn't know exactly when or where, but, you have to. You have to let it out.
Final, like, big question. Do you think that this whole experience, this birth and all of the deliveries, have changed the way that you view control, not even in only birth, but also in parenting and life?
Yeah, I think, one of the things I've prayed for, like, most of my life is to be able to give up control because I know that I'm that kind of person that just I love it, I love it. I love to be in control and know what's gonna happen and know how things are gonna go. But I think especially, like, how close we were to having a bad outcome and how thankful I am that just we're here and we're healthy and I can live to tell my story. That puts everything in perspective. And I realize, of course, I think I told you a little bit about, but the biggest thing about everything when I look back on it was that I prayed through the pregnancy repeatedly for the right people to be in the room. And of course, I thought that was the right people to encourage me and help me have a vaginal delivery. Well, instead, it was the right surgeon because my OB wasn't on call, but Dr. Bennett happened to be on call. And he's the one that they said Dr. Veman would have called him in had she been here. Like she would have called him for help. So he was the surgeon that I needed. And had anesthesia not been there, he could have put me under, whereas most of the others are not going to be comfortable or trained to do that. But anesthesia, which they are on call for the weekends there, they had come in for an orthopedic case that got added on, which turned out to be your sister-in-law's husband doing that case. And I talked to her about it later, and she's like, "Yeah, they said there was some crazy C-section going on, and that's why our people weren't here." And so yep, I said that was me. Anesthesia being there already to manage my epidural so that I didn't have to go under and add that to the recovery or, to not I can't imagine people that have to go under general for a C-section, like, and to not at least be aware of what's going on. And then the pediatrician was also already there. And so she was right there to basically catch him when he came out and start working on him and do everything he needed. And my friend Stephanie being my nurse. And then there was another girl that I knew from Blessing previously, and she's a medical student. And I just felt someone holding my hand out of nowhere. And I looked up and I said, "Is that Lakin?" And she said, "Yeah." So she held my hand and talked to me for a while as he was working on stitching everything, which took a long time. So, yeah, just to see how God turned that around, what I had prayed for the whole time happened exactly in the way that He planned it, and He knew what we needed all along more than we did, and now I can share that. So, His plans are better than our plans, and I know we say that, but when you see it in this way, you believe it a lot more. So
Beautiful. My goodness. Jen, what an amazing story to tell, and your faithfulness and your joy about it and your vulnerability and saying like, "Hey, it's not like this all the time." I absolutely love it. I have some lightning round questions. I'm gonna nix the ones that I have because those you covered so beautifully. I want to end on such a positive, upbeat, forward thinking. What is your favorite thing about the like 2-month-old stage? Like right now, as you're snuggling, what's your favorite thing about this stage?
he has just started really smiling a lot more and kinda making some of those cooing noises, and just to see him, like, light up when I'm talking to him is amazing. That is definitely seeing the world through their eyes as they get a little more in tune to things is pretty cool.
Pretty cool. What would you say to the man listening or the woman who might be going through labor again? What would you say to them in saying, like, hey, ask for this in the room if you really want it? For me, I remember wanting a ham and cheese sandwich with Cheetos, and I had that for as long as possible. So, like, what is it? And then my sister had donuts delivered the next morning. It was phenomenal. Do you have anything like that?
Nothing specific, but literally anything you want. That is the one thing that, when you were saying, like, the difference between Joel and Levi, like, I felt so much more empowered to do things my way. And so even though I didn't end up in a vaginal delivery, like, I did have things I wanted and things I asked for. I didn't do routine cervical checks in the office. I declined those. I told them where I wanted my IV, just little things that, like, you can be in control of that, and, I did a little bit of eating when I probably wasn't supposed to. Sorry, Doctor Beeman, if you're watching. So just things like that, like, you just know what you want and don't be afraid to ask for it.
I love it. Jen Duesterhaus, if you're watching our YouTube, Levi has awakened his sweet little eyes and now he's cooing at mommy. Oh my gosh, Jen. Oh, I know your ovaries are still sensitive, but mine are very much alive, and that was adorable. The cool thing about Jen too is that she is sharing her story online. And so we have ways for you to connect with her on Instagram so that you can connect and learn and ask. And when we do this thing in community, life is so much sweeter. And so we will link all of those opportunities for you to connect with Jen on Instagram and Facebook. But Jen, thank you for sharing your story and thank you for being bold enough to tell us the real.
Thank you.
Remember, deliveries are really hard and you can do hard things. Thank you for listening to the Working Moms Redefined podcast. It is not lost on me that you chose to spend time together. Thank you. Let's connect outside of this space on socials. We'd love for you to follow us on Instagram, Facebook, LinkedIn, Pinterest. We've got it all to connect with you. If you feel as if someone in your life could be impacted by this message, feel free to share it. That is the biggest compliment. As we part ways together, remember, you can do hard things.